following that announcement by government today that the cohort 18 and older can now be vaccinated. What will be the socio-economic impact of vaccinating the youth, and how do we convince young people to take the jab? To talk to me about this, I'm now joined by Youth Capital Project leader Kristal, Duncan-Williams, ANC Youth League convener Nonceba, Mhlauli, and Assembly of the Unemployed Activist Siyabulela Mama. Good evening to you all, and thank you very much for your time and joining us tonight here on In Focus. All right, hope you can hear me there. Kristal, I'll start with you. Has government done enough, and to what extent has government done to at least instill a degree and a level of confidence in the effectiveness and safety of vaccines in young people?
So from our conversations with young people, I think it's clear that the government hasn't done a good job of communicating enough information in ways that young people can engage with, in places that young people are, and in languages that they understand. So I think, you know, if you're a middle-class person and you're accessing the internet all the time and you speak English, I think there's a lot of information. You know, I get a lot of things through my medical aid. But the average young person, just from speaking to young people in our network, there seems to be quite a lot of vaccine hesitancy. And I think that's just, you know, a lack of information. And we all know that there's lots of misinformation out there. Fake news is rife. People are sharing things on WhatsApp left, right, and center, which is where young people are. And I think the government could do a better job of combating that by making sure that its message is more pervasive and more present in the places where young people engage with that kind of content.
Yeah. What are their concerns? I mean, if you talk about the competence and the reliability of the vaccines themselves, what are their concerns?
I think it's the concerns that everybody has from all of the, you know, the fake news that vaccine was developed too quickly. How do we know what the long-term side effects are? So I think very similar to the fears of the older age cohorts who also have been vaccine hesitant. And I think the way we combat that is with credible information from credible sources. But I don't think we're telling young people enough where to find those credible sources and what those credible sources are. So, you know, we at Youth Capital, we had an Instagram conversation with a journalist from and an immunologist from Iwozo, and we had a great chat, and that's on our blog post if young people want to go and check it out. And it answers all of the questions. So we had questions around, what are the side effects? How do we know that it doesn't cause any long-term side effects? Why was it developed so quickly? If I'm a foreign and national and I don't have documentation, what about me? These are the concerns that young people out there have, and so we try to address those in that conversation.
So, Nonceba, I mean, what we are hearing, even with adults, what we are hearing, even with the aged over 60s, is that what will be key in shaping confidence in the vaccines would be the correct type of communication or messaging, right? Let's talk then about whether we have that capacity. Yes, we've made the announcement now that the over 18s can get vaccinated, but do we have that capacity to be able to successfully deliver the message to the age group and therefore be able to successfully roll out the inoculation program?
I think, one, we welcome the announcement as made earlier today to bring forward the date for those below the age of 35 to start getting vaccinated. You would have known that most of us were really waiting in anticipation for the 1st of September for us to be able to start getting vaccinated. So, one, we welcome the fact that it was brought forward. Two, we are of the view that it is actually quite long overdue, and in that if you want to actually reach your herd immunity, we are actually of the view that we should have actually started with your population, which is actually in its majority, and we know that that is young people in South Africa. So we think that bringing forward the date one will actually assist us in getting to the point where we want to get faster, because now you are dealing with the majority of your population grouping. I do think that at a communications level, and this is also sort of me wearing my other hat, a lot has been done, of course, to try and bring about awareness. There's been constant, updates around, the vaccine rollout, the various procurement processes around the vaccines, daily updates that are being done. But of course, as the previous speaker has said, that fake news does still, present itself as a major threat to people not wanting to take up the vaccine. But I think lastly, if you look at the excitement, the numbers to which the previous cohort, which is your 49 to 35, actually took up the vaccine, and the numbers that we got to so quickly, it does show that there actually has been some really good work that has been done in terms of spreading the message and getting people vaccinated, notwithstanding all the challenges, of course.
Do the young people trust the institutions that deliver the message?
I think that to an extent, yes. If you can look at the excitement just from today, where we've got the message that we can actually start getting vaccinated. People were saying, okay, what are we going to wear? People are planning around, going in groups. People are planning around which sites to visit, and so on and so forth. For me, that does show some level of confidence in the carrier of the message, and also the service itself, because if that wasn't the case, we wouldn't even be having this conversation to begin with. So I do think that there is some, some semblance or levels of trust or confidence that is obviously shown in the carrier of the message, as well as the institutions providing the vaccines. But of course, as we are saying, that it is something that is long overdue, and we do think that we should have gotten to this point faster than we have.
Yeah. Sia, has there been a powerful demonstration to the young cohort, 18-year-olds in particular, that there is benefit to getting vaccinated? We talk, for example, about watching football matches in Europe, where now stadiums are full, while here in South Africa we still can hardly get 20 people into a stadium. And of course, those things don't just speak about the entertainment element, they speak of the economic impact of having that stadium being there, and the kind of trade and economy that is then able to exist. Are young people open to that conversation? Has it been demonstrated to them powerfully enough?
Yeah, no thanks. Look, as much as there is vaccine hesitancy, but there is great zeal for people to get vaccinated. Majority of young people want to get vaccinated because they understand the importance of vaccine. The problem, however, is transport. Transport should be made available for people to access vaccine sites, and I think that's another most important thing. Transport should be made available, but at the same time, it should not end there. We have in South Africa a problem of hunger and malnutrition, which is, by the way, linked to the issue of the immune system. So you'd get that 80% of households in South Africa don't afford to buy nutritious food in the food basket. And then you have the over 10 million people who go to bed hungry every week. And so these should be addressed. These should be looked at the problem, because the reaction, the immune system goes with this. Yeah. And there's also the problem of unemployment. Over 11.4 million people are unemployed. And this also, 70% of this is the youth. Yeah. So it should not end in the issue of providing transport, because people are willing to get vaccines. But it should also link with other socio-economic issues. And this is where the importance of the basic income grant comes in.
Yeah. So what you're saying then, Sia, in a sense that for a successful inoculation program, particularly with this cohort, the other socio-economic challenges would need to be addressed as well.
Absolutely.
They're talking a question of, for example, incentives that would get young people interested, or play a competition, giveaways, and that type of thing. Is that the type of thing that young people would be interested in?
Yes, absolutely, absolutely. And so young people would be interested in those things. But it also should be linking with socio-economic issues. Because, once your immune system is low, you get some sort of a bad reaction to the vaccine. So these issues link. And with any medicine, you have to have sufficient nutritious food for it to work in a better way. So this issue actually links to the socio-economic issues that we face. And that's why we welcome Minister Zulu's intervention with the basic income grant, because they are linking.
All right, Kristal, Duncan-Williams, Nonceba, Mhlauli, as well as Siyabulela Mama, they stay on with us here on In Focus. We'll take this conversation a little bit further, talking about those delivery modalities that could certainly get young people participating in the inoculation campaign. So Duncan-Williams, Nonceba, Mhlauli, as well as Siyabulela Mama, and we're talking modalities that could encourage responsiveness now to the inoculation campaign in young people. Kristal, 2 or 3 things mentioned here today. One is, of course, take care of the socio-economic needs of young people, things like transport, things like some food on their stomach, but also look at some incentives that could get the young cohort more responsive. Any more ideas that we could be looking at? The professor earlier on was talking about influencers, and maybe they can play a role.
Absolutely. I think we've seen in places like the US and the UK, getting local celebrities to really stand up and say why young people should get vaccinated, because those are the people that young people are watching on social media, right? So I think if we can get some really prominent voices, as you say, some local influencers to spread that message, that's great. Another thing that we need, as I said, is engaging content. Young people don't want to read pages and pages of information and boring documents with lots of words. They want snappy, cool infographics, short videos, and Ewozo, which is a partner organization that we work with, is doing a great job of putting together that kind of content. So I think if we can just leverage some of the resources that other organizations have developed and get them out there. And then I think Sia has raised some really important points. Young people are living full and complex lives, and many of them are tackling the huge challenge of trying to find work, and all of that has been made worse by the pandemic. And so for us at Youth Capital, we're very excited about this announcement. Young people can only show up for work if they are healthy and well, and getting vaccinated is one step towards that. Obviously, fixing the economy is the other big part of that problem. But I think having young people return to some kind of normal life, both at school and in work, is a huge step for their mental well-being, which has also taken strain. So I think this is a great step, but as Sia says, it's one step of many that needs to be taken to really support the young people of this country.
Yeah. Nonceba, is this government ready to have that conversation that good and well, you're saying young people must get vaccinated, but after they are vaccinated, they want an effective functioning society that creates jobs for them. They want to know, okay, now I'm good and healthy, where do I go? Now I'm good and healthy, what am I going to eat tonight? Are they prepared for that conversation?
I think that one, we when you look at healthcare in this country, and linked to the point that one of the colleagues made on I think in the previous round, before you get inoculated or vaccinated, for that matter, you need to have access to healthcare. And I think that's the most important thing. To say that even if you are saying that you are opening, for this new cohort, are we ensuring that, the people or the young people in your most rural, remote areas in the country have access to those vaccination sites? So, I think for me, that's the most important thing. Are we ensuring that, healthcare workers go out to the people, or must people go to your urban centers to get, access to healthcare? So I think for me, that's a very important point, and we must ensure that all young people across the country, in all corners of the country, do have access to this particular healthcare service. That's one. Two, we've actually, as the youth, characterized the levels of youth unemployment as a pandemic on its own. And we've even said that we want to see the kind of response that we've seen in terms of the COVID-19 pandemic and how quickly governments around the world, and particularly ours here at home, was able to put in place measures to respond to this pandemic. We want to see the same type of, quick response to this, volcano that's currently erupting, called youth unemployment. You would have seen young people all over the country, not all over the country, but in predominantly two provinces a couple of weeks ago, engaging in looting, precisely because they are destitute, precisely because they don't have, this sort of hope and belief in a system that they believe they've been excluded to. So we do want to see the kind of response that we've seen to COVID-19 to be the same kind of sort of haste that government has undertaken in terms of responding to the pandemic of youth unemployment. We are also saying that if government does not do that, if government does not respond to this pandemic, what we've seen a couple of weeks ago in terms of the looting, the vandalism and things like that, you will literally have an uprising on your hands, and it would be an uprising that is led by young people because of the fact that they find themselves outside of the economy of this country.
Yeah. Siya, the government has prioritized the social relief of distress grant as one of those interventions when it comes to the socio-economic needs in societies. They say we've even expanded that to caregivers. They can be able now to claim from that particular fund. Do they need to review that particular process?
Yes, absolutely. So the process needs to be reviewed, and I'll tell you why. One, so let's make the example that people are working. While they're working, the money goes to rent. We talked about people who actually have work and income now. The money actually goes to paying electricity. It goes to paying other needs within the household. And it takes away the money that should be going to nutritious food baskets, right? And then when you look at precarious workers and caregivers, by the way, who earn about 3,500 a month, that money is so dire. And when you check the 350, and for the unemployed people, and you get it into a day, it's about 11 rand, which cannot even buy a loaf of bread. So we need money that people will be able to afford the food basket, the nutritious food basket, which people don't have access to, by the way. And it's a constitutional right in South Africa, by the way, to have this nutritious food. So as much as we welcome the government's intervention, but we're saying we want a basic income grant, a permanent basic income grant that will cover the food basket, and that I think that would what we would speak to, and that's why we welcome the talk and Minister Zulu's say about thinking about introducing a basic income grant, because I think this will help, because this actually links to the nutritious needs that we have in South Africa. And it actually links to the immune systems of people, because that's what it speaks to. It's really what it speaks to. Like you cannot have in a country 80% of households who cannot afford nutritious food within the food basket. It's a dire situation. So we need a permanent basic income grant that will also at least meet these issues halfway.
Yeah. Importantly, though, Siya, I want to put the question to you, and what is your organization doing as part of getting young people involved with this vaccination campaign?
So we're actually part of the People's Vaccine Campaign. And one of those things has been actually highlighting issues of vaccine apartheid. What does that mean? And actually encouraging people to get vaccinated, because it's very important in fighting this pandemic and getting us closer to living our normal lives. So we're actually part of the People's Vaccine Campaign, and we have been encouraging our comrades and friends to actually get vaccinated, because it's a very important thing to do. So on our side, and you've had many communities in Free State, in Botshabelo, who have community kitchens, and they discuss these issues of vaccine and why they're important. You have communities in Mpumalanga, eMalahleni, like the SRGRC, who communicate the issues of vaccine. So that's actually, this is also part of the mobilization work, because remember, we cannot also even go to the ground and talk to the unemployed people because we ourselves are restricted by this pandemic, and the vaccine is another way of getting us out of that situation.
Yeah. When evaluating where we are right now, Kristal, Duncan, and what role government has played up until this far, what can make it better, and what is your organization doing in that regard?
So I think, I've touched on it, just getting information to young people in ways that they can engage with. So as I said, we hosted an Instagram Live. It was a bunch of young women on the call. So I think that was great. And we put the blog post together, and we are currently in discussions with Ewozo, who have a bunch of resources, as I mentioned. And we're trying to figure out how to engage with young people. So I think what Youth Capital does well is create spaces where young people can really talk and not be talked at, which I think is often the mistake that government makes. Tokenistic engagements where there isn't really opportunity for young people to be present and participate. And so, Youth Capital has those conversations on WhatsApp, where we know young people are, which is data, low on data costs, and finding ways, Twitter Spaces is something we're engaging with as well. And so having those conversations in spaces where young people are